Yes.
Okay, what is my number of patients?
1.
The mechanism of injury?
MVA. Motor vehicle accident.
That's it? Okay, and then I'm gonna request ALS. And then I'm gonna have my partner here hold C-spine. Okay, what is my general impression?
You find a female laying down on the ground complaining of back pain, and you can see that in her left arm she has a laceration spurting out blood.
Okay, what is her level of consciousness?
She's ANO4.
A-N-O-4. And then what is the chief complaint?
She's complaining that her back hurts.
Back pain? Okay, so I'm going to manage bleeding. I'd cover the wound, but since it's an arterial bleeding, I'm just gonna apply a tourniquet. Okay, and then has the bleeding stopped?
Yes.
Okay, so I'm gonna move on to airway. Is the airway painted?
Yes.
Okay, and then after I have time on the tourniquet, the airway's painted, so I see no need for an OPA or an NPA. As far as breathing, is the patient breathing adequately?
Yes.
Okay, so I see no need for oxygen therapy. Do they have any injuries that are compromising the airway?
Not at the moment that we can see.
Okay, in circulation, have we controlled all bleeding? Is there any other major bleeding?
No.
No, okay. What are the skin signs?
He's normal, warm, and dry.
Okay, pulse?
Pulse is normal, setting at 80 beats per minute.
Okay, well, I'm gonna have this high priority patient, code 3, transport, and then I'm going to initiate shock therapy. So I'm going to position my patient in the supine position and apply a blanket, and then now I'm going to go into my after I do transport, I'm going to go into vitals, and then so she's a code 3. I'm gonna what's the blood pressure?
Blood pressure is sitting at 133 over 76.
Respiration?
Respiration is 20.
Okay, has a pulse changed though?
No.
No? And then, okay, so now I'm gonna go into my sample history. Can they talk? Are they talking?
Yep.
Okay, are there any allergies that they have?
One's penicillin.
They're allergic to penicillin?
Penicillin?
Penicillin? Are they on any medications?
No.
Any past medical history?
Just a broken femur.
A broken femur? And then, what was the last thing they ate or drank?
He had orange juice and a toast.
Orange juice and toast. And then, what were the events leading up to this accident?
He was driving on his way to school.
Okay. So since I got vitals and I got sample, I'm going to my secondary. And I'm going to have my partner keep holding C-spine, but I'm going to check the scalp for any bleeding. I'm going to check my glove. I'm going to check the ears for any CSF. I'm going to check the forehead. I'm going to check the eyes, the nose, the mouth, the face in general. Look for DCAP-BTLS. DCAP-BTLS stands for deformities, contusions, abrasions, penetrations, or punctures, burns, tenderness, lacerations, or swelling. I'm going to look into the neck. I'm going to look for any tracheal deviation. I'm going to look for any JVD. I'm going to palpate the cervical region. Is everything okay?
Yep.
Okay. I'm going to move down to the chest. I'm going to palpate it, and I'm going to listen for lung sounds. So when I go to listen for lung sounds, are the lungs clear?
Yep.
Okay, equal?
Yep.
Any kind of issues with them?
No.
No? Okay, so then I'm going to move down to the 4 quadrants, to the abdomen, and I'm going to palpate each one. Any pain anywhere?
No.
Okay, well then I'm going to move down to the pelvis. I'm just going to apply some pressure. Is there any pain with that?
No.
Okay, I'm going to move down to the lower extremities. I'm going to check both of them at the same time. Check it for decab BTLS. I'm gonna check one individually. Anything?
No, everything seems good.
Yeah, I'm gonna go down to the foot and I'm gonna check for CSM, so circulation. I'm gonna check pulse and or cab refill. And then their motor, I'm gonna ask them to push down and up. And then I'm gonna ask them if they can feel where on their foot I'm touching.
Yep, the big toe.
Okay. And then I'm gonna check the other for CSM, I mean. I'm gonna check pulse again, cab refill, motor, sense, everything okay?
Yep.
Gonna move up to the upper extremities, since that arm has a, oh, I'm gonna check their general area too. Since that arm has a tourniquet, they're not gonna have a pulse, and they're not gonna feel anything I'm doing. What about this arm? I'm checking for decab BTLS, CSM, can they feel what finger I'm touching?
Yes, they're index finger.
Do they have strength? Can they move their arm?
We're conscious asking.
Can you move your arm? Yes. Okay, thank you. And then, okay, so CSM is good. And so now that I'm done with that, I'm gonna log on the patient and I'm gonna check their posterior side. So then, can I get somebody to come help me move the patient? So we're gonna be moving towards me on count of C-spine.
Okay, we're gonna go on 3, all right? 1, 2, 3.
Cool. Okay, so then I'm gonna be checking the cervical again. I'm checking for any secondary injuries. I'm gonna check the thoracic and then the lumbar spine. Is there anything?
Nope.
Check for decab BTLS. I'm gonna check the buttocks area and the lower extremities again. Check for any decab BTLS. Do I find anything?
Nope, looks good.
Okay, so we're gonna lower the patient down. Here we go. 1, 2, 3. Okay. So I'm going to reassess the patient every 5 minutes and address any secondary injuries and
Can you tell me how you manage any of the secondary injuries and wounds appropriately?
yeah, we could dress the wound and then we could just transport to the nearest hospital.
What'd you do for him?
I'm sorry?
What'd you do for the patient?
For the patient?
Yeah, what therapy did you do for him?
Oh, cool. I applied a tourniquet and then I didn't apply any oxygen, so just the tourniquet.
Okay.
And then, yeah, that's it.